Dr. Kevin Most, you can text in your ailments. We'll try to get to your questions, as many of them as we can. Andrea's here. And Dr. Kevin Most is here. Hello, buddy.
Hi there. How are you guys doing?
We are doing just fine. I know you're on the road now. Are you in North Carolina?
I am in North Carolina, yeah, and I think it's, the can up the tree to talk is...
you sound fine.
So
you sound totally fine. We have a combination of fog and drizzle and wind chills in the 20s. You want to come home?
I'll tell you, I am looking out on a golf course right now. The azaleas are blooming. The dogwoods are blooming. It's probably 70 degrees, and I think I'll stay here for a couple weeks.
I want to join you.
That's probably the case.
I want to join you. But you know what, though? There was a story that piqued my curiosity about air pollution in Chicago, and it said at one point, Doc, that at one point last year, Chicago had the poorest air quality among 95 cities.
Was that when Canada was burning? When we got all that stuff from Canada?
Yeah.
Was that it, Doc?
Yep, that was part of it, absolutely. But think about that. That at one time last year, out of the 95 cities that they look at worldwide, we had the worst. I mean, that's amazing and shows you the impact of what those wildfires did and how the air quality in Chicago at that time really impacted individuals with heart disease and asthma. But it was amazing when you look at that stat and go, holy cow, just a simple, I shouldn't say simple, but just a natural disaster like that and how it can impact a city that is thousands of miles away.
What about asthma? What do people do if they have that?
Well, you know what? I mean, the big thing there, when the air quality gets that poor, probably the most important things for asthmatics is to make sure, one, you have your medications on a normal basis. Two, make sure you have your rescue inhaler. That's that inhaler that you're going to take a couple puffs when you get short of breath. And then 2 or 3 is make sure that you have air purifiers in your home so that at least the air quality inside is going to be much better than it is outside. And we do get a little concerned with asthmatics, during the summer and when we have bad air quality.
How do we know a good air purifier?
Well, that's a very good point because there are so many out there. So, you look at HEPA filters and you look, probably the most important thing I would do, and I hate to push Consumer Reports, but go to Consumer Reports and Google it because they're going to do a whole bunch of tests on it. Because everyone can say, we remove 99.9% of particulates. They're running their own tests. These are done independently. So certainly having those and making sure that people with allergies, that you have one in the bedroom where you spend almost half the day sometimes to make sure the quality there when you're breathing and you're asleep is excellent.
I'm glad you brought this up because we had a humidifier in the bedroom that's only a few months old, but it lost its mind the other day. And the difference in one night was amazing to me. I woke up like I'd been stranded in the Sahara. And so would I have a humidifier and an air purifier, or do I not need both?
Well, in the winter, you certainly do. The humidifier in the winter is so important because the air gets so dry, and dry air is almost as irritating as some of the pollutants that we bring in. Especially if you're not breathing through your nose. Breathing through your nose, you humidify the air that you're breathing in by the time it gets to your lungs. For individuals who breathe through their mouth and they snore a lot, you're going to breathe dry air in, and it doesn't have that chance to be humidified. So what happens is you get a sore throat, you get the irritation, but certainly that. Now, I will say one thing is that we're coming close to the time where we're going to be turning humidifiers off as humidity increases as much like it is today, and then looking more at dehumidifying, trying to get rid of some of that humidity in the air, which can lead to more molds and other issues that people are allergic to as well.
This is right around the time of the year where some seasonal allergies start to begin. Well, at least in our case, after the snowfall comes tomorrow. But this is the time of year where I always say, I don't have allergies, but yet I need, the Zyrtec or So is there an over-the-counter that you would kind of prefer more than others?
Well, Andrea, I think you said it. The way you asked the question is a good way because people say, I don't have allergies. I have a sinus infection.
Right.
So I need my Z-Pack. No, you don't. You do have allergies. Now, I will say it's very interesting. If you looked at pollen counts and mold counts yesterday or the day before this rain, it was high. Today in Chicago, it's great. You come down to North Carolina, the cars are green because it's pine pollen season, and people with bad allergies it's ripping, and it's heading up north. So certainly trees will start to pop very, very soon up there. grass probably won't go until mid-May, but certainly you are going to start to see those. As far as what medications you can use, definitely the Zyrtec, the Allegras, those are the non-sedating ones. Be careful if you're using the sedating antihistamines, because if you are, it's going to make you groggy. So if you take 50 milligrams of Benadryl, you're going to be taking a nap halfway through the day, and you want to make sure that you don't do that.
And when it comes to Zyrtec or any of the over-the-counters that do work for you that are non-sedating, you can take them every day forever?
Well, no, not forever. It really depends on your allergies. And again, there's Zyrtec and Zyrtec D. What's the difference? Zyrtec is just a straight antihistamine. So if you're just trying to control your allergic symptoms of, runny nose and itchy eyes, and then the D is for those individuals where they're congested, where the sinuses get congested and they think they need an antibiotic. I tell people, no, take your Zyrtec D, take your Allegra D. The decongestant there will help clear out those sinuses. Now, that being said, individuals that have a lot of junk in their sinuses for a long period of time and start to get pain underneath their eyes, or start to say, oh my gosh, I'm blowing out a lot more green stuff, or have low-grade fever, stuff that's left in the sinuses long enough will get infected. But for the most part, at this time of the year, it's going to be allergies that are going to be triggering it, and not a viral or bacterial infection.
So the reason I bring up taking a med every day is because what happens is if in allergy season you take it, sometimes you forget to stop taking it every day.
Yes.
You know what I mean? You lock in a routine of taking something every day. And if I hear you correctly, what you're saying is if we're not in the middle of a bad bud run, and the allergy numbers that you see on your phone now or from the weather folks, then don't pop the pill.
Right. If your allergies are to grass and tree, you don't need to take them in the middle of the winter. If your allergies are to dust and dust mites and mold, you need to take them pretty much year-round, because those are going to be here year-round. So it's a good idea to at least know and just monitor when your symptoms get bad. People are going to start saying here now, middle of April, oh, my symptoms are getting bad again. All right, you probably have a tree allergy, or you have a grass allergy. You have something that's blooming and pollinating at this point. But come, later in the year, my ragweed certainly is going to start popping here soon. But some of those others after the fall, it's like, wait, I don't need to take this medication every day.
Mm-hmm. Andrea has questions about Parkinson's. When we come back, I'm going to ask you about blood thinners, since I take one every day as well. In the 20-plus years that Doc Most and I have been doing this, he has taught us more about medicine and everyday things that we as regular folks need to know, including how to get the most out of your doctor's visits. So, Doc, we always appreciate what you do. So one of the things he did back in the old days, so if you don't like this show, it's his fault. He saved my life. I had a pulmonary embolism. I didn't know I had it. He told me in no uncertain terms to go to the emergency room, went in, found out I had blood clots in my lungs. I had two others since then. And the closest they can come to a solution is that I have something called an antithrombin 3 deficiency. A lot of you probably just thought I have a personality or a hair deficiency. Those are also true. But the antithrombin 3 thing puts me in a position where I take blood thinners every day. And it appears that there's some good news on the horizon for people that have the same situation where they do.
Yeah, Steve, I remember that day like it was yesterday. Kind of strange. But, I remember, I can tell you where I was standing when we had that conversation. Mm-hmm. So, there's a lot of people who take blood thinners right now, whether they have a clotting disorder like you do. Some people have atrial fibrillation, have to take blood clot medicine because we don't want blood clots to form. And it's interesting, when we think about, we do want blood clots to form, right? If I cut myself, I want the bleeding to stop.
Yep.
So there's two different ways that this happens, right? One is external. If I cut myself, it's going to stop. But the internal ones, like you, there's no reason for you to form a clot. You don't need clots in your body unless there's trauma there. So what we've been looking at is, the medications that we use, a lot of people are on Coumadin. That's a medication that blocks both the intrinsic and the extrinsic. So it makes both stop. So you have an increased chance of bleeding now if you were to cut yourself, or you're going to take longer to heal. But what they're doing right now is they're finding that if we can block one factor called factor 11, that's the one that does the intrinsic one. We don't need to form clots inside the body. So if we can block that one, then we won't have to worry about all the blood testing we need to do, and about all the other side effects that we get from the other blood clot medications that we're taking right now.
And the statistic in your notes that you passed along, which we post with the podcast, by the way, 10 million people are going to need these medications by 2030. That is only, 5 years, 9 months away. Are they going to be able to get it all approved by then?
Well, you hope they would. I mean, they're in phase 3 trials right now, so that's really good. But the other interesting point you bring out is there's 10 million people. There's probably, of those 10 million, probably 3 to 4 million won't take the medication. They'll rather go at risk than to take the medication, whether it's because of the cost, because some of these medications, the Xareltos and the Eliquis, are a little expensive, or it's I can't do the Coumadin because I don't want to go in and have my blood test. So certainly this is going to be fast-tracked. There's a couple companies working on 3 different drugs, and the results are fairly promising right now. So it will be great if we say, hey, in the next 2 to 3 years, these medications come out. There'll be blockbuster medications for that portion of the population. Not blockbuster for everybody, but certainly will make a huge impact in those individuals who want to be safe while they have this disorder and don't want to have the hassle of going in to have blood tests.
Absolutely. Dr. Most, we also wanted to ask you about news in JAMA this week about a biopsy test that could allow for the identification of people who will end up with Parkinson's. Very interesting story.
Yeah, when we think of Parkinson's, a lot of people say, oh, that's an older disease. Well, think about Michael J. Fox, who was diagnosed at the age of 29. And you say, well, how do you do the diagnosis now? Well, the diagnosis is actually done based on your symptoms. So we start to see the symptoms that we see in people's motor activity, in other words, how they move, walk, how their arms move, how they shuffle, and that's how we do diagnosis for Parkinson's. And at that point, now the disease is fairly advanced. What they found now, and it's interesting because we've been so frustrated with neurologic illnesses, whether it be Alzheimer's, Parkinson's, MS, we're starting to find out more based on the actual biology. So what this study came out of JAMA showed that they did biopsies on individuals and looked at the proteins around their nerves and then followed those individuals. And they found that there's a protein that hits these nerves in people with Parkinson's, up to about 93% accuracy as far as diagnosing it.
That's an amazing number, and in the process, that could really change people's lives. We have sort of an extended question from it that happens to come in from a listener about essential tremor. Is tremor part of Parkinson's?
Yeah, absolutely. Some people can have tremor. Some people can have cogwheel rigidity because of it. Because what it's doing is it's stopping the messages going to the synapses in the brain to show you how smoothly your arms and legs should move. Now, Steve, the big thing is it's not going to change a lot of people's lives right now. And then you say, well, why is that? You always tell us if we can diagnose something early, then we can make changes. Well, that's true, but not in all cases. In other words, even for Alzheimer's, certainly there's some blockbuster drugs out there. Hopefully we'll see some with Parkinson's. But right now, we don't have a cure for Parkinson's. Great that we can identify it earlier, and is now going to allow scientists and researchers to start to look at that protein and say, okay, how can we block that protein? How can we stop or slow the progression of that protein? In other words, make a true impact on the illness. Whereas right now, we still just have the old-fashioned medications for it, which unfortunately fail after a period of time.
How do you know if tremor is not just part of getting older, or, you're tired at the end of the day? I mean, I have a thing, where occasionally my fingers or my hand
like twitches,
a little bit of tremor for a few seconds.
Yeah.
But then I realized that maybe it's a carpal tunnel thing because I was leaning on something. When is it serious enough you should call the doctor?
No, I mean, you're absolutely true. Even the essential tremors, some of the tremors that you're going to have here, people can have essential tremors and not have Parkinson's, obviously. So certainly there are more side effects and more things that go with it. Some individuals only have a tremor in one hand. Why? They did damage to a nerve there in their arm somewhere that is sending messages to those muscles to have them fasciculate, to shake instead of to actually move. So really, if you have tremors, if you have issues like that, definitely get in to see the doctors because they can at least take a look at you. They might do some tests called EMGs where they put little needles in you and test to see how functional your muscles are and are they moving appropriately. Because some of these illnesses there are treatments for, or at least some things that will slow down the progression. Physical therapy is even some of the things that we'll use. Something as simple as making sure we're using the muscles appropriately and strengthening other muscles so that we don't rely on some of the muscles that are bothering us.
But again, so this is not a cure. It's just medications that could manage some of the symptoms.
Yeah. And it's going to be, we've identified something that we see in 93% of the people. So, okay, now that we see that, what can we do to impact that protein? What can we do to slow it? What can we do to remove it? The advancements in the SARS, the medication and the treatment are going to come over here over the next 4 or 5 years. We're already looking at that. Now it's just at least we have a diagnosis that we can use by doing biology, by doing a biopsy, versus waiting till someone has full-blown symptoms.
What if I, again, I don't know if this is related to aging, but what if I start chasing cars?
Yeah, as long as you don't have a lot of milk bones, and that,
That's probably just a sleepwalking thing. It's Dr. Kevin Mose. Great information, as always. You are the best. We appreciate it. Enjoy your weather, because ours sucks.
You got it. You guys take care. And AD, sorry about Illinois. Basketball is over. I don't care what happens next weekend. With U of I out and Kansas out.
I agree with you.
Honestly, I couldn't care less about Connecticut and Purdue, but, if somebody's got to win, make it a Big Ten team.
Yeah, make it Big Ten. But, yeah, you're right, though. Thank you, Kevin.
You got it. Good talk to you guys soon.
See you, buddy. He's a Kansas boy.
I know.
Yeah.
I know. We've
along
gone
with our
back
friend
and
Tom
forth.
Kelly.
Yeah.